Welcome to Through the Eyes of She, Equity in Health, Education, Business, and Leadership for the African Woman in the 21st Century. Please utilize the chat and Q&A features on the side of your toolbar. Please use the Q&A feature to submit any questions for the panelists. This session is being recorded. Thank you.
Hello, everyone. Welcome to this panel. Thank you for joining, and thanks so much to the organizers for pulling together what is a really outstanding program over these 2 days. We're really grateful for the opportunity to be able to participate. My name is Erica Lenander, and I direct a group out of Yale called the Global Health Leadership Initiative, or GHLI. We're based out of the School of Public Health, and we focus on building management, leadership, and organizational performance for all kinds of public health and global health challenges. So we're kind of grounded in the belief that to reach all of our global health targets, we need effective management, effective leadership. And so we're really passionate about how do you get teams and organizations working well together. We work across 3 pillars. The first pillar is building leadership, which is what you'll hear about today in this panel. Our second pillar is around catalyzing innovation. So getting entrepreneurs equipped to build teams and organizations that can bring their vision to life. And then our third pillar is around strengthening health systems, where we work directly with Ministries of Health to help shape and then support implementation of their visions for reform of health service delivery. Of course, we're an academic group, so across all of that, we focus on generating evidence in terms of what works across all 3 of those pillars. So really trying to make that link between practice and scholarship. Over the our past fiscal year, we had the opportunity to work with and to graduate more than 1,200 health professionals from our various programs around the world, and that reflects engagement in 36 countries. We're only able to do that through deep partnership with Ministries of Health, with implementing partners on the ground, folks like you'll hear from in the panel today. So really, really grateful for those partnerships. The panel that you're about to hear from draws from our experiences with the EpiLamp program, EPILAMP. And EpiLamp is a leadership and management program for senior Ministry of Health officials who are responsible for immunization system performance in their countries. So EpiLamp is a Gavi-supported program that thus far has reached 27 teams from 27 countries, including over 100 alumni, including the 3 rock star women that you'll hear from today. In recent years, just as everybody else has done, EpiLamp has pivoted to a fully virtual model in the context of COVID, which has been, kind of a really exciting adaptation process. For this panel, I'd like to introduce 3 of our EpiLamp alumni. And the reason that we put this panel together is because, like so many of us, we see that women are systematically underrepresented in leadership roles in Ministries of Health. And yet we also know that women make up a very large proportion of the public health workforce. And so you see this real disconnect. And so needing to figure out how we get women into leadership roles within Ministries of Health, and once they're there, support their success. And so kind of removing all of the systematic barriers to success for women in leadership roles in Ministries of Health. We think that EpiLamp is just one aspect of all the important work that needs to be done to support women in leadership roles. So without further ado, let me go ahead and introduce our panelists so we can get to the real meat of the program. Our first panelist comes to us from Zambia. Dr. Patricia Lupeta Bobo is the Assistant Director for Child Health and Nutrition in the Department of Public Health at the Ministry of Health. She is a pediatrician. She's a public health specialist, and she has championed, kind of service delivery, both for immunization services as well as for all kinds of maternal and child health programming within Zambia. She's also served in a number of technical roles outside of the Ministry of Health, including for the Zambia Flying Doctor Services, the Elizabeth Glaser Pediatric AIDS Foundation, and with Family Health International. So she really understands how to kind of operate and how to make connections across a bunch of different partners aiming to support strengthened health services within Zambia. Most importantly, she's a mom of 2 girls, so she knows why we're all doing this work, this pediatric work. And most recently, she has actually championed, based on her experiences in the EpiLamp program, has also championed the launch of a follow-on program that Yale and Gavi is offering called the V-STEP program for strengthening of immunization supply chains in Zambia. So again, always kind of making those connections and getting things done. Dr. Bobo. Our second panelist, also an EpiLamp alumni, comes to us from Uganda, and Dr. Rachel Bayagira is a medical officer and technical advisor for viral hepatitis within the Vaccine and Immunization Division in the Ministry of Health. So Dr. Rachel has a lot of really interesting experiences, certainly offering leadership within the Ministry of Health. Prior to that, as a World Health Organization consultant in Sierra Leone, so working across country contexts and kind of bringing all that perspective and experience and expertise to the program. And I will say that Dr. Rachel kind of led the Ugandan team through the EpiLamp program, always providing really interesting insights, pushing the envelope, really challenging the team to think differently. So Dr. Rachel, really, really happy to have you here. And our final panelist in alphabetical order is Dr. Leah Wondrosen. Dr. Leah is currently the senior advisor to the Minister of Health in Ethiopia. Prior, when we first met Dr. Leah, she was working as the EPI manager, the immunization program manager in Ethiopia. She then moved into a technical role with PATH, where she also joined us as a coach within the EpiLamp program. So she was a student and then an alumni and then a coach, and is now back within the Ministry of Health, serving as that senior advisor to the minister. Obviously, just a testament to the way that she's able to think strategically about complex challenges and then translate that into meaningful policy and practice guidance. So Dr. Leah, great to have you with us today. Pulling our whole panel together is someone that I have the pleasure to work with every single day, Linka Ineza. Linka is a program manager with the Global Health Leadership Initiative. She oversees a lot of our leadership development programs, including EpiLamp and now the new V-STEP program. Linka has, somehow you can see it's, multifaceted programs running what seems like seamlessly. She really thinks critically about the content of our program to make sure that it's contextually relevant and kind of just-in-time content, because we recognize that we're working with very senior ministry officials. She's built great relationships with all of our participants and alumni, including our 3 panelists that you'll hear from today. So Linka, thank you for pulling this group together, and I will turn it over to you.
Thank you. Thank you, Erica, for this great introduction. The idea of having this panel, I think Erica mentioned that the idea of having this panel is because, our EpiLamp program that Erica just talked about, in the evaluation, we realized that women had demonstrated greater gains in leadership and management competencies than their male counterparts. But yet we know that they are underrepresented in these senior leadership roles. And I think a recent WHO report highlighted that 70% of the global health and care workforce, women represented 70% of the global health and care workforce, but only 25% of represent only 25% of the senior leadership position. So with that, we thought, why not we have amazing women in EpiLamp, amazing leaders. Why not put together a panel of these amazing leaders? And this is where today we have Leah, Rachel, and Patricia, who I've had the opportunity to work with. They are great leaders, and you heard in Erica's introduction, they are great leaders in their field, so we can learn one thing or two on how to build pathways based on for women in leadership in health settings in Africa, based on their experience being great leaders within the Ministry of Health and in their careers. Yeah, so let's dive in. So I would like maybe to start with maybe Rachel. Could you please share how did you grow in this relationship in these leadership roles? How did you move from one role to the next?
Thank you very much, Lenka, and good morning, everyone. I'm happy to be part of the team, and thank you very much for the introduction. So it's not been an easy journey, but it's a manageable and workable journey. So I will start with maybe an account of how I moved from my undergraduate studies. I joined an infectious diseases institute. Now, there was this amazing thing about the institute. Most of the junior doctors there were very, very ambitious. So you either had to stay in there for 10 years, or you stay a minimum 3 years and move on to a next role. So one of the roles was you either become a research program assistant, or you can actually join a master's or postgraduate course. So in my case, I actually decided to join a master's course that was after 2 years at the institute. So when I joined the master's course, we were only 2 females out of 9. And I knew I had no option, but I had to win. So I'm a very competitive person. So I had to compete with the guys and make sure I make it to the top. And within those 4 years of the postgraduate course, I made sure I'm at least a student leader. So I pushed my way somehow, and I became a student leader. I was a representative of my department, the ear, nose, and throat department. So I actually enrolled for ear, nose, and throat surgery. So while in there, there was this vacancy that the WHO put up. I remember we were completing our final year. The WHO put up a vacancy for, they were looking for ear, nose, and throat specialists to go work in West Africa. And by that time, there was this epidemic of Ebola. So of course, that was a bit scary for everyone, but I had all the courage to apply. I knew there must be very many other people applying for the same position. I applied as I was completing my, my postgraduate course. And voila, to my surprise, I actually had I got the position and I moved to Sierra Leone. So while there, I was given this big responsibility of training, building capacity for healthcare workers on ear, nose, and throat diseases. So I had to really work with the Ministry of Health there. That was my first leadership role. I wasn't sure of myself, but somehow I knew within myself, I knew I had to do it. And indeed, with all the guidance I got from the other consultants at the WHO office in Freetown, I worked hard to make sure that all that was given to me, all the roles that were given to me were actually, I had to make sure I do them very right. Then it's within there that I actually enrolled for a master's in public health. I now gained interest in public health, and that's how I end up in public health. And I had to apply for a bigger position at my Ministry of Health back in Uganda. And as luck would have it, I got a position. And while I was in there 2 years down the road, I was given this big responsibility of, taking up a technical advisory position for infectious diseases, and which I gladly took up. And I must say, it's not been an easy one. And really, it's not all about yourself, but when you look at other, when you look at other ladies in, other ministry, I noticed that actually they are pushing their way up, they are ambitious and all that. So I had no choice. I've been pushing myself in there, and I know this is not the last leadership role that I have. I'm going to take up more leadership roles after this. Thank you, Linka.
Thank you, Rachel. There was a lot that I heard that we're going to come back to. The fact that you took on this leadership role without really knowing that you were a leader. So we can come back to that for now. But let me turn on to Patricia. Patricia, can you tell us, how did you grow into these leadership roles, and how did you move on from one to the next?
Thank you very much, Linka, and Good morning, good afternoon, good evening, everyone. I'm greatly honored to be here. So, in Zambia, after one finishes their internship, you have to do a minimum of 2 years. You have to serve what we call mandatory rural posting. And it is quite scary because you can be sent to any part of the country. And so after my internship, I started preparing myself for it. And when I was actually due, and like my friends, I actually approached my seniors and reminded them that I was due for posting. And I think that somehow worked in my favor because I was actually sent to the Zambia Flying Doctor Service, which is an affiliate of the Ministry of Health. And it is actually, based in the third largest city in the country. So it wasn't very remote, though by the nature of the job that we used to do, we used to find ourselves in all parts of the country, very remote in some aspects. And so I stayed on, and in my third year, I decided to, upgrade myself. I studied for master's in public health. A year later, I came back to the same institution. Months later, a vacancy arose for deputy director, and I applied for the job, and I had to compete against 2 male counterparts. And I must add, we were 5 medical officers, and I was the only female. So I applied for the job, and I got it. And I think that was my very first leadership role, so to say. I just want to fast forward maybe 10 plus years later. I find myself at the main teaching hospital. This time around, I'm a pediatrician. And one of my former classmates, who was heading a rural province in Zambia, asked for me to go and help him set up some systems within the province. I decided to go for it. I went there, but this time around, I think because of family dynamics and a lot of other issues, it was a bit difficult. So after staying just for a short while, I had to go back. So I asked to go back. And when we started having, discussions with senior management at the Ministry of Health, there was a vacancy at one of the first level hospitals within the capital city. So I gladly took it, but I needed to go and get my letter of appointment. And it was, a surprise for me when I went to get my letter. It had nothing, it said nothing about the position that I was, prepared for. I found myself, given this position as Assistant Director, Child Health and Nutrition. And, that's how things happened. And, so I always say, in summary, for me, I think what has worked is, embracing change and also taking, opportunities when they arise. So I think that has been my journey in summary. Over to you, Linka. Thanks.
Great. Thank you so much, Rachel and Patricia. One of the things that I'm hearing is that you found yourself into these leadership positions. As I hear you talk, you found yourself into these leadership positions. And sometimes we think that we need to have the skills to be in there, but you went for them. You had the courage, you were bold. You're like, I have to apply for this. I'm able to do this. I have to apply for this. And I think, Rachel, you also brought up a point. You said, I wasn't a leader when I took up that position. So if I may ask, when did you realize that you were a leader? And how did that change how you behave?
Yes, Linka. Like I said before, I realized when that I was a leader when I was in Sierra Leone. I was given this huge position and I didn't know how to actually carry myself as a young medical, postgraduate, fresh from, ENT surgery. I'm like, okay, what is this? I could see these big consultants, these ladies who are, carrying themselves in very expensive, having expensive watches, expensive bags, and I'm all there junior. I'm thinking to myself, okay, I need to be bold here. So that's when I realized that, wow, I really need to grow up. I need to calm myself down and work towards my goals. So that's when I actually realized that I'm leading a big team and I'm a leader and they've given me all this trust. So I need to, work towards it.
Thank you, Rachel. And how about you, Leah?
Good morning, good afternoon, and good evening, everyone. Thank you, Yale conference organizers, for having me on this conference. Mine is a little bit different from what Rachel already mentioned. Actually, I grew up in a kind of democratic and middle-class family. I was told that as a father of 3 daughters, my father took the lead in cultivating us in that way. So since childhood, I believe I had the belief in myself, and I believe I can lead. So I cultivated through the years in resuming bigger positions, as my colleagues already mentioned. I started my professional career back in 2007. I joined one of health science college in southern part of Ethiopia. Then starting from graduate assistant level, I grew up to the lecturer level, and then back in July 2012, I joined Ministry of Health. That was in officer position for health promotion and disease prevention. Stayed there for 3 years. Then I grew to another level of EPI manager position in 2014. Stayed there for around 5 years. In addition to the API managerial role, I also had the opportunity to serve as assistant director for maternal and child health programs. So that was how it was all started to be manifested. I am afraid to say that it started there. I believe it started much earlier, but that is where I exercised leadership. Then following that, I had, as Erika already mentioned, I had the opportunity to work at PATH, and that's where I also contributed as a coach for EPI LAMP, stayed there for 2 years, and recently joined back to my home office, I can say, where I started my professional career to the Ministry of Health as senior advisor for the minister and COVID-19 vaccine rollout. Yeah, this is how it came to the level where I am right now.
Thank you, Leah, for reminding us of the role of just a supporting father or brothers in building the leaders that we already are, awakening that already. Yeah. So maybe Patricia, if I turn over to you, you described a little bit how you found yourself in this leadership position, really, and I want to know, like, how did you realize you were a leader, and how did that change how you behaved now that you were in this leadership position all of a sudden?
Okay, so I've always looked at my profession, being a medical doctor, as one of leadership because of the decisions that we have to make. And I think even as a junior officer, when I was practicing, you were always working in teams, and we often depended on others to actually carry out our orders. And, for me, I think once in a while, I would actually realize that I was, in charge of this particular team. But like I said, my first leadership role is when I served as the deputy director at the Zambia Flying Doctor Service. And, this was very interesting because I wasn't only dealing with fellow medics, but there were also pilots and engineers and a lot of dynamics, and I had to sort of oversee all that. It was very interesting. But when I look at my current position, I think one of the things that really struck was the fact that I was now at a national level, and I realized that I was part of the policymakers who actually, were making policies that were going to impact the whole country. And I think I found that very exciting, but at the same time, quite humbling, where I told myself I needed to do my best. And also, in terms of behavior, I think one of the things that I struggle with most of the times is the issue of, dressing appropriately. In the hospital setup, you're very casual, and I've always been very casual. So I needed to be reminded initially, Patricia, please wear a jacket. This is a formal meeting. You're going to meet such and such a person. So those were some of the adjustments I have had to make. And I just now, I've taken it upon myself. I usually put a jacket, carry a jacket in the car, just in case, I have to look very formal and, please the system and be part of the system. But it's also very important because I tend to meet a lot of different people, and I hope even just the image, can actually inspire, the young ones to, aspire for leadership. So that's how things have been for me. Thanks.
It is really great to hear the boldness in all of you guys, the boldness, the courage, the courage, how you embrace change in these leadership positions as you move from one role to the next. And maybe if we could, I would be interested in knowing some of the challenges or barriers that you faced in exercising these leadership roles. Maybe Rachel, I could start with you.
Yeah, thank you, Linka. For me, it's been more about the self-doubt, that lack of self-confidence at the beginning as I was taking up these roles. I would ask myself, can I really do this? Can I really lead a team? Do I have to pretend? Do I have to be myself? But the moment I learned the trick of actually overcoming, the self-doubt, then everything went in the right direction. So that's what I can say about that. It's been more about the self-doubt, but I overcame it. Yeah.
How about you, Patricia?
And when Rachel was talking just now, I was just thinking to myself, oh, okay, that's what have been me. I think we all go through things like that, self-doubt. But I think the other challenge I've had to cope, to cope with is the issue of juggling between family life and, work life. That has been a great challenge in some cases. Like I said, at some point, I actually had to give up my position in one of the rural provinces because my family was here in the capital city and I had to move on. But I must also add, there are times when you feel the male folk, they don't take you seriously. And sometimes I think just to, like to test you, they'll start making these unwanted, passes, very uncomfortable situations sometimes we find ourselves in, and I've had to deal with that. But unfortunately for me, I think even some women, fellow women, sometimes are not always very supportive. So I always think when you talk about issues of equity, issues of fairness, I think it actually, looks at both males and females. So I think as we address those things, we have to address both, and those are the things that I've had to personally deal with.
Thanks, Patricia.
Yeah, if I may add, Linka. I completely agree what Rachel already said and Patricia added, especially the family component. As a mother of three, I can tell a lot how it is challenging to be in a leadership position and at the same time to be demanded as a mother. So I can't imagine where I would be now without having a very supportive family and surroundings, including colleagues. But now I really want to draw this discussion to the level where each correspondences with the subordinates or immediate supervisors will not be easy for female leaders when you compare it with the male leaders, because confrontation is most of the time is common. People will become doubtful of your capacity due to your age or something else, that they have their own perspective. So they usually take time to accept your decision and guidance. So it is always challenging I can say it takes some time to convince them that you can. I think it took me some time to convince the media supervisors, but through times they become more relent when they see your commitment, when they see you growing through the leadership career, then they become more convinced. One other challenge that I would like to mention is learning opportunity. There are no opportunity, be it in self-learning platforms or on-job trainings, opportunities are very limited. So these are the major challenges that I would like to mention. Thank you, Lenka.
And sorry, Linka, just to add, you know, as Leah was speaking just now, I just realized that I think these are some of the issues that most of us actually go through. And, you know, when you move from the clinical, you know, setup to, you know, administration, people just take it that you know what to do because, you know, you are a doctor after all. Even issues of orientation are not there. And these are some of the things that we need to change because, you know, there's always a lot of things to learn. But people don't realize that they'll just throw you in the deep end and expect you to swim on your own. And you're lucky if you are going to have, you know, people that are going to actually help you to find your way. Just thought I should add that.
Linka.
Thank you. Such a great, yeah. Yes, go ahead, Rachel.
One thing, yeah. When Patricia says, oh, she's a doctor or she must know everything. Now, in my case, it was a bit different. My superior thought, oh, you're a surgeon, you should be in theater. What are you doing in administration? And I said to myself, I have public health and I'm competent enough. So what are you talking about? So it's a two-way thing, you know. Thank you.
Yeah. This is such a great conversation. And I think we've, I have faced those challenges. And I believe even other women have faced these challenges in any women leadership position. So I'm interested in knowing how do you respond to these challenges? What has helped you navigate successfully these career challenges? Maybe I can start with you, Leah.
So may I start, Linka? I think the most important thing for me is knowing the technical details is critical. You know, that is something that you should do on day one. You have to be well accustomed with all the technical details that you are leading, either whether it is very technical or if it has like other components, social or psychological or even political components, you have to be aware of that. That is one key thing. But building relationship, I think that is the backbone of leadership. You have to have a healthy relationship with your subordinates or followers, and also media supervisors or other senior supervisors. That is how you can get your back, and that's how you can be fully confident that things are going as you planned. If I may add one thing on this is when I first start as EPI manager, I used to focus more on the activities on the tasks. The human components were not there. You know, I was rushing and focusing more on executing things. It really affected the overall performance because most people were not that much happy because they were not fully heard of their issues. They might have family issues, social issues, or even their own personal or health related issues. So that is when I start to change to become more accommodative, more listener, and build a personal relationship or communication with my team members, then things start to flow very, very smoothly and become more productive.
Thank you, Leah. That's very interesting. How about you, Rachel? What has helped you navigate successfully these challenges?
Yeah, thank you. And Leah, thank you for that. I will not repeat some of those. To me, I think actually leadership is such a big sacrifice in all aspects of life. It's really a big sacrifice. So some of the tools that have really helped me are seeking advice. I mentioned earlier that I had a problem of self-doubt that made me lose that confidence. But when I started seeking advice about it, getting to my female counterparts, asking them, how have you made it? How did you overcome this? Then that started giving me that self-confidence, and I started believing in myself. And that's why I looked at things as impossible. And the other tool was more of having a mentor. It's very important as one goes through these leadership roles, you have to have a mentor. So in my case, I have 2 male mentors who've really helped me in all aspects of my career growth, in my career change. Really, those are some of the tools that have really helped me not give up and continue pushing. And I believe these can also help others. Thank you.
Yeah, thank you, Rachel and Leah. And this brings us to it's interesting hearing how you overcame these challenges. And this brings me to this question of what are the actions that you've taken to promote gender equity in your workplace? And there is a question for you in the chat, Patricia, on how have you worked to counter this? So basically, when you mentioned the detrimental impact women can have on other women, there is a question: how have you worked to counter this or help other women to unlearn that behavior in the workplace and ignore it, to be allies to other women? Yeah.
So sometimes when people say a lot of things about you, it's because they don't know you very well. And there are people who have been in these positions for a long time, and then you go there as a stranger and you're given these responsibilities, and people will always say a lot of things before they know you very well. But I believe that being very consistent in what I do and just proving to everyone that it's about hard work and nothing else. And I've had people afterwards who'd actually come to me and say, you know what, we thought you were just being favored, but no, you actually know what you're supposed to do. So for me, that is something that I usually want to use. When I have things like that, it can be very exhausting. To start to dwell with confrontations and things like that. But most of the times, people in leadership positions like myself are elderly, and you don't want to go that route. But just be humble, continue learning, and sometimes even going to them to ask questions when you're not very clear. Then they'll know the kind of person that you are, and somehow that's how we get to resolve some of these issues. Not very easy at times, but it's something that we have to work on every day. That's how I'd respond to that.
Linka, may I add?
Yes, Leah.
Thank you so much, Rachel and Patricia. I think we all have some deep down doubts whenever we are given a leadership role. Will I be able to execute things as expected? What is the immediate supervisor's expectation? Is the objective or the goal is too high to achieve? There are many questions that you ask yourself, but pushing yourself towards the goal and pushing in resuming the positions is key, as my colleagues have already mentioned. And if there are opportunities, one critical tip I have for all participants is don't miss opportunities. Whenever the opportunity is there, grab it. Nobody learned leadership, since birth. It is a continuous process of change. That is something that you learn. So start reading, start exercising, start consulting. And as Rachel already mentioned, it's good to have somebody to rely on to consult some critical issues, some complex issues. So don't waste opportunities, grab it and move to the next level.
And maybe, Linka, just to add, when I did my EpiLamp, I was actually about 8 months in my new job. And of course, I knew a lot about immunization issues from my training as a pediatrician. but there are certain, structural issues that you actually have to learn on the job. And I took that opportunity to learn. And I remember, I think in the introductory lecture that we had, where we were taught to be very open. And I think that is how I've actually taken, myself after that. Everything is a learning opportunity, even from the list of, the people that are under you, the opportunities for learning. So I always just open myself to learning, and then, asking a lot of questions, sometimes irritatingly so, but I think that is how you learn. And when there's an opportunity like what Leah says, you grab it and try to make the best of it. It usually works, just thought I should.
Yeah, it's interesting that you say that, Patricia, because in APLAMP, in all the cohorts, every time when we start the program, women tend to be they do not talk, but we have this building learning a community. We try to bring everyone. The faculty really tries to engage everyone, and at the beginning of the program, most women they just sit, listen, and then basically there are male colleagues who are really talking, leading the group work. But then at the end of the program, we see women really leading this group work. So it's really interesting that you bring that up, because that we've seen that in APLAMP too. Yeah. Rachel, how would you like to expand on that?
I'll maybe talk about what I've really done at my workplace. I started a small group about 2 years ago of female leaders from different divisions at the Ministry of Health. So once a month we meet and talk about the challenges we're facing and encourage each other. It's very interesting, the things you hear in such meetings. And when you hear about things like sexual harassment in this day, age, and time, really you get this feeling that we really have a lot of work to do. We really have a lot of work to do. So I think those small groups really help. They keep you moving and they encourage you. In there, you find 1 or 2 people really that you can lean on. Yeah. And maybe also adding on the APLAMP, I think, like Leah said, we need to take up all these opportunities that come by. So when the opportunity for APLAMP came, I remember I think our team was the biggest. Uganda had the biggest number. I was the last to fix myself in there. They wanted 5, but I said, no, I have to get in there. So I think taking these opportunities is really a good thing. And I'm so glad really that I joined APLAMP. The skills I learned, they are very invaluable. Yeah, thank you.
I'm building on that. As EPI managers, back home, you are somehow kind of, in quotation, a boss, no one will come to you and teach you what to do. Even if they know better, no one will dare. But in the EPI LAMP, we were there, even rehearsals, practical sessions. It was because before COVID, so I had a chance to have even practical sessions. So that was an amazing experience I had as an EPI manager.
It's great to hear experiences in APLAMP, and maybe building on that, I'll be interested in knowing what do you think how leadership and leadership development programs can help support women who find themselves in leadership roles? How can these programs like APLAMP help support women who are in leadership roles?
Linka, can I start?
Yes.
Yeah.
Go ahead.
I think one of the things that struck when I was doing the APLAMP, program was the fact that most of the trainers, most of the mentors were actually female, and that actually tells you something. I think we are all looking for role models, and when you find, people that take up that position, it's always very gratifying. But it's also another thing to say, I'm also going to try to be a role model, for other people, so that I can mentor these people, and then, just to, inspire them to also want to be like me at some point. You talked about me being a mother of 2 girls. For them, I'm a hero, That has not always been easy, but I would want to go beyond that. I do take time to talk to my friends whenever I have opportunities, just to encourage them. Like I said, when you go through something, you want to leave, things better for your friends. So like I said, where you have a lot of issues from, sometimes male counterparts, even females, you don't want to be like that. You want to actually help, people navigate that. And, when you have tools like what we learned during EpiLamp, for me, that is something that really changed my mind, because I felt very confident, going forward that, I was going to use these tools, not only, for the EPI program, but for many other issues. And I also just wanted to say that I think, like Erica mentioned in the, when she was introducing me, one of the things that I try to do is to also connect my colleagues to such programs, because I believe have benefited a lot. And so when we had that an opportunity for people to enroll in the V-Step program, for me it was an opportunity to actually encourage a lot of people to go through that, and also hoping that they're also going to learn a lot of things that I have learned, and I'm also going to use those tools to actually take them to a higher ground. Yeah.
Rachel, would you like to go to add on to that?
Yes, I'll add something. Our EpiLamp was a bit unique because of the pandemic. So it was mostly virtual. We didn't get to meet, in person, our trainers, the trainees. So it was mostly virtual. But one thing I really learned about this was more about networking, the importance of networking. However virtual it was, somehow we are connecting with maybe countries like Ethiopia, connecting with Ghana, knowing how, like, during this COVID vaccination rollout, we are actually learning through experiences. What are you doing? As we are doing this, all that kind of things. So for me, it's not all about learning the skills and all that. Even the networking is very, very important in such programs. Yeah, thank you.
Leah, would you like to add on how, Leah, I know you've taken maybe 2 leadership programs, other than the EpiLamp, you took another one. How can this program help support women who find themselves in leadership roles?
I think one critical thing that I like to mention is there must be a fixed quota for women leaders. Some in developing countries, especially, the competition is very tough, and there are family issues, social issues, economical issues, which are all dragging the women leaders back to where they are, because the grows in professional development careers is not always easy. So fixed quota has to be allocated, one, and a special attention must be given for women, especially on education sector and health, because these two are very critical even for overall growth of a country.
Thank you. Yeah, those are very interesting additions, and it highlights the importance of investing in leadership and management programs for women, so that they can gain these skills and be able to are well equipped to lead when they find themselves into these leadership positions. Yeah. So there is one question in the chat, actually more. The first one that I want to ask, what system within the Ministry of Health can support your leadership, so that it's not just an individual challenge for each woman? What are the systems within the Ministries of Health that can support the leadership? that can support you?
One thing is giving opportunity, and being a backstopper for all women leaders, and has putting mentors. And in addition to that, in our ministry, we have additional point for women competitors whenever they run for any position. 3 to 5 points will be an addition because of their gender only.
And Linka, for me, just to add, I think we need policies within the ministry. I mean, I think in the workplace generally that promotes fairness in the recruitment process, and also just to, fairness within, in the workplace. And for those people who have worked in the civil service, they know that the system is very rigid. And most of the times, I think it's male dominated, like you rightly said at the beginning. So for example, where I'm working, out of 17 directors, 4 directors, we only have 4 females. And yet, like you rightly said, we have more females in the health sector compared to men. And now we have 10 positions for provincial health directors, and all of them are male. So these are some of the things that are not fair within the system, because I believe looking at our expertise, they can actually come up with deliberate policies to make sure that there's fairness in how they allocate some of these positions. And I think we don't always have to fight for certain things as women. I think we just deserve some of these positions because we are capable, and we can do as well as men. It's as simple as that. That's what I would add.
Yes, I'll add that on that, Patricia. Yes, the balance is very, very important indeed. And for us in Uganda, it's the opposite. So all our 3 health ministers are female. So the men find it very unfair too. So yes, there should be that balance, and women should be recognized, and they should know that actually women are competent enough, to compete with the men. Then also, I think promotions, because you find that someone like you said, the public service system is really not fair. So you find promotions are really not the norm. Someone will be in the same position for 10 years. So I think loosening that would also give women that courage, to compete for, higher positions. Yeah.
Thank you. Thank you for that. Yeah. There is one more question, and this one is directed to Patricia. I am intrigued by the notion of a dress code. Is this an experience other women have in the health space? Is that why I have been sidelined for promotion? Maybe Rachel and Leah also could jump in on that.
No, I don't think so. It's just one of the things that is, rigid about the space, but I don't think that is the right thing. And I also just wanted to say that for the first time, I think since I joined, we actually have a female minister right now. So we are very excited as women, and we hope things are going to get better. I think as having a woman in play, as minister, you can only hope for the best. I think we actually do quite well. Don't you think so? Yeah.
Thank you. There was one last question, and I think I can answer that. I'm interested in knowing how the EPLAMP recruitment process was done. And I think, so the recruitment process for EPLAMP, maybe for those who missed it, it's a 9-month program. That's how long it takes. And this program was funded by Gavi, and we built it's and led by the Global Health Leadership Initiative, and we built a national we build leadership and management capacities within national health managers who are responsible for the expanded program on immunization within the national countries, and this was done in 27 countries. Yeah, it's not a fellowship program, unfortunately. Yeah, but that's you've heard a lot about it. Maybe that's why the question came up. Yeah. So I think if there are no more comments, I think that we're going to wrap up. For more questions, we can direct them to the participants, to the panelists, so that they can answer them later. And then maybe Nora or someone else could help us send these. So we're going to have to wrap up. Thank you so much for everyone. For me, some of the takeaways were be bold, embrace change, and be ready, take on those opportunities. And then for young women seeking advice, build those relationships in the workplace. And for those women who are in the leadership positions, being a role model, and also and also for men as well, reminding them that you're a father, you can also help bring opportunities for women in the workplace so that they can move into these leadership roles. And at the Ministry of Health level, we heard that really changing the system, bringing representation within the Ministry of Health, and health system function better. The health system will function better when we have women who have an equal say in the delivery and the design of the program. So my takeaway is women are drivers of change. That's what I'm taking away from this panel. So thank you so much, everyone. Thank you for attending and participating in our panel. Remember to take if you haven't already, please make sure that to fill out the survey of this panel. The link to the survey can be found in the chat box. Yeah, we will convene again in about 5 minutes for the beginning of our next panel. Thank you everyone for your attention.
Thank you.
Thank you so much, everyone.